Hello everyone, my name is Priscilla Appiahene. I am a physician associate and I work in gastroenterology. I decided today to speak about a common topic that I see all the time in my clinics, which is irritable bowel syndrome, also known commonly as IBS. So IBS is a very common condition of the digestive tract, essentially. And the exact cause is unknown, but we think that some of the reasons why you get IBS is that your nerves and your gut may be more sensitive, and also things may move through too quickly or too slowly, and that can cause certain symptoms. The most important symptoms that usually are associated with IBS are things like bloating, stomach cramps, excess wind or flatulence, constipation, and also diarrhoea. And these are quite common symptoms that people experience. They may come and go, or they may, you may have a flare for a few months and have continuous symptoms during that time. I think the most important thing, if you feel like you may have IBS, is to first of all see your GP so they can run some tests and make sure that it's not anything else. Some other things that it could be celiac disease, which is a gluten intolerance, or something more serious called inflammatory bowel disease, where you may have blood in your stools, diarrhea at night, which are more serious symptoms and do need more investigation. So when you go to your GP with the symptoms that you have, they will run some tests, do some blood tests, some scans, and maybe something called an endoscopy or a colonoscopy, where they have a camera test going through the mouth to look inside the tummy, or a camera test up the back passage to have a look at your large bowel. So I'm just going to give a few tips once you're diagnosed with IBS. It's a lifelong condition and you need to manage it. So a few tips to help in terms of lifestyle and diet is to cook homemade meals with fresh ingredients. That usually helps. Try and eat little and often rather than having large meals, which sometimes sit in your tummy and are hard to digest. Exercise regularly. Another thing that you can try is something called probiotics. Some of the common names are Simprove or Alflorex, and these probiotics essentially help with gut bacteria, and they help you to digest food, essentially. Other tips are to basically make sure that when you have symptoms like bloating or excess wind or flatulence, that you essentially try peppermint tea after meals or peppermint oil or capsules, which you can ask your pharmacist about, and doing those things may help with the bloating. If you have abdominal cramps, then something that you can try is a drug called Buscopan, which usually helps, and in medical terms it's called an antispasmodic, which helps with the pain that you experience. If you find that your symptoms are more constipation dominant, then things to do are increase your fluid intake. So the recommended fluid intake is 2 liters, but if you find you're constipated, 3 or 4 liters might be what you need to help soften the stool. You can try laxatives like fibrogel to start off with to see if this helps, and also try modifying your diet and eating more fiber, more fruits and vegetables, and also exercising more regularly. If you find your symptoms are more diarrhea dependent, then things that you can try are, Imodium or loperamide, but again, contact your pharmacist before you start any of that medication. There is another FODMAP diet that people can try, and FODMAP essentially stands for fermentable carbohydrates, including oligosaccharides, disaccharides, monosaccharides, and polyols. And those are the scientific terms for a class of carbohydrates that usually are notorious for causing IBS symptoms. When you go on the diet, essentially you try cutting out these foods that contain these carbohydrates to see if that helps with your symptoms. It is very difficult to do the FODMAP diet on your own, so the best thing to do is to get a referral to a dietitian to help you with that. And a lot of people sometimes find that they find that triggers for their symptoms and are able to essentially avoid certain foods and be okay and avoid symptoms completely. So those are my main tips for dealing with IBS. I think that one of the first things that you should do if you feel like you have symptoms is actually keep a food diary as well, and make sure you keep a track of what you're eating and find any triggers, any particular foods that trigger your symptoms. So that's basically my take on dealing with IBS. Thank you.